Hello everyone, my name is Dr. Radek Kaczmarek. I am a postdoctoral research associate at Indiana University School of Medicine in Indianapolis, USA, and an assistant professor at the Hirschfeld Institute of Immunology and Experimental Therapy at the Polish Academy of Sciences in Wrocław, Poland. And my experience within the field of hemophilia includes immune responses to factor replacement and gene therapies for hemophilia. I am pleased to share with you an overview of our symposium titled Thrombin Generation, the Goal of All Hemophilia Treatments. This session is sponsored by Sanofi Genzyme and is scheduled to broadcast on Sunday, October the 3rd at 7:30 p.m. Central European Time, as part of the virtual program at this 2021 EHC Conference. I am delighted to be chairing this symposium because I am passionate about hemostasis in general and because the topic of this symposium is very timely, insofar that there is a number of new therapies under development that are well on their way to join the hemophilia treatment armamentarium and that will require different approaches to laboratory monitoring and a different perspective on how hemostatic correction is accomplished. I am also excited to be joined by Dr. Maria Mancuso from Italy and Professor Dan Hart from the UK, two distinguished faculty in our hemophilia field who will lead the two presentations in this session. The aim of our symposium is to provide you with a comprehensive overview of the central role of thrombin generation within hemostasis. The presentations will highlight the role of thrombin in hemostasis via simplified coagulation models. We will also take a closer look at treatment approaches and specifically how they improve thrombin generation, and finally review the management of the risk of thrombosis with various therapeutic approaches, including both the factor and non-factor treatment options. This presentation will cover concepts that might not have been highlighted previously to you, but they are important to understand the underlying disease of hemophilia and to understand the differences between individual patient treatment approaches. So, why are we focusing here on thrombin generation? We have normally been focusing on improving the clotting process through targeting different factors in the coagulation. But how well do we know or understand the role of and the importance of thrombin generation in this clotting process? And why should we consider this important in hemophilia management? Thrombin generation is a critical activity for multiple functions in hemostasis, which is the natural balanced process of stopping bleeding at the site of injury, all the while maintaining normal blood flow. Thrombin is a key protein orchestrating and driving multiple events leading to formation of a stable fibrin clot. Bleeding onset recruits activated platelets in the plasma to the site of the blood vessel injury to form a plug to stop bleeding. This plug is then surrounded by a fibrin mesh produced and strengthened by thrombin, resulting in a stable clot. Fast generation of sufficient amounts of thrombin to produce a stable clot requires several other coagulation factors, including factor VIII and factor IX. In people with hemophilia, the potential to generate thrombin is lowered because they have low levels of factor VIII or factor IX. Without being able to produce a stable clot, people with hemophilia can bleed excessively. Altogether, deficiencies of factor VIII or factor IX in hemophilia can be viewed as a deficiency of thrombin generation potential. Therefore, the goal of all currently available and investigational hemophilia therapies is to enhance the potential for thrombin generation to restore effective hemostasis and prevent bleeding. Have you also considered what your bleeding phenotype is and if all patients bleed similar to you? Thrombin generation is in fact an accurate marker of different bleeding phenotypes for people with hemophilia, compared to assessing just the levels of coagulation factors in the plasma. However, as we learn more about what novel therapies have to offer, there are key things to consider with these different treatments, such as their impact on thrombin generation potential, differing mechanisms of action, monitoring their treatment in hemophilia patients, and also ways of managing any risk of thrombosis. All of this is covered in more detail in the full symposium recording that will be available on the EHC 2021 conference platform Sunday, October the 3rd, 2021 onwards. Don't forget, if you are listening to this ahead of our symposium, we will have a live question and answer session where you will have an opportunity to ask questions to Dr. Mancuso and Dr. Hart by posting your questions using the EHC conference platform. I and my fellow faculty for this symposium are certainly looking forward to an exciting, informative meeting. And if you are listening to this podcast after the conference has finished, I encourage you to go back and watch the full video recording of this interesting session on the EHC 2021 conference platform. Thank you and enjoy the conference.